Plastic surgery is always a very personal decision. So we take that decision process very seriously, and we work to partner with you in working to find things that may help you reach your goals. It's certainly not for everyone. Today, we have a couple great patients that are doing breast surgery. I'm Nick Slenkovich, Denver Body Doc. We are getting it started in the operating room. Welcome, and come join us. This is a great breast augmentation casing. It's got some challenges with asymmetries in size and shape. We want to get a larger, rounder shape and a pretty shape, of course. You've got one breast that has a little bit looser skin envelope, rounded underneath. The breast is lower, hangs out to the side, and is larger. Another breast actually has a tighter lower pole where things dome up, almost like it's inward curve and a shorter distance underneath. So two very different breasts. When you work to get this lower breast to expand and round out, this breast needs a slightly smaller implant, but we need to get it to come up. So we're going to do a peri-areolar based lifting of this breast. This breast we're going to reinforce with mesh to help support the lower breast as we're working to release and get the lower breast to push out and round out to the degree we possibly can. I've injected numbing medicine. That does infiltrate the breast some or enlarge it slightly just from the fluid, but you can see this inward curve where the areola actually domes up some on this right side. You don't tend to notice it when your breast is natively this shape, but if we enlarge it, get it rounded out, we do tend to notice it more. And this breast is larger and is got more natural rounding to it. So a very different shape, and that's where we're going to work to do things to get as much symmetry as we can. But no, we'll never get it perfectly symmetric. We've made our pocket on both sides and placed the implant. Made the incision down below on both sides. This is a case where I want to control as much as possible, knowing that we're not going to be able to control everything. So I've released tissue underneath on this right breast to work to get rounding. You can see it's so far rounding nicely. I think that's going to be very beneficial. We'll place the left implant. And this is a smaller implant. Okay. Perfect. We are finished. So we've brought this left breast up and in, reduced its size some, ended up moving a little bit more skin to get the nipple position higher, implants on both sides, reinforced with dissolving mesh. I think it's going to be a really nice result. Always going to be over round initially at first. Over time, that breast settles down into the lower pole.